Hey everybody, this is Pamela. This will be the second video that I've tried making that will hopefully be successful, that I'm not making via webcam, just because I know how to do the direct webcam uploads. That's what I've done ever since I've been on YouTube, just doing quick videos on the webcam, acting stupid, whatever. And as you know, that would be very limiting because I can only take videos like in a very tight little margin of space right at my computer desk, because I've only got like home computer. It's not like I have a portable laptop or something. Anyway, so I didn't do a week 35 update for my pregnancy, so this video will be pregnancy week 35 and 36 because I'm right at the end of my 36th week. I'll be 37 weeks on Monday, and this is Friday night. So since my last video, I feel like I've had no time to myself whatsoever. So every time I've tried to make a video, even on the webcam, I haven't been able to. I got a phone call from my doctor near the end of my 35th week telling me that they did find the rest, the missing component of my diabetic blood test, and I do in fact have gestational diabetes. And when they called and told me that, I was burning up with a fever with the terrible virus that me and all my children had. And that was just one more bit of bad news that I didn't want to get that day. I've absorbed it now and I've accepted it, but it's not something that you want to hear at all. And then you start going back to guilt factors like, oh, is it because I'm overweight? Is it only because of that? And obviously I know, and you know, that when you're overweight you're more likely to get something like that. But I'm not going to sit here and go over, well, if only, because the fact is I'm at the end of the pregnancy now, and I have it, and I have to deal with it. So I had to go to a special appointment at the diabetic center, or whatever you want to call it, and they just showed me how to do my blood sugar testing and everything, and they showed me the margins I have to try and keep it in. They gave me like nutritional counseling, which, you know, I'm not sitting around eating a pound, like a big 10-pound bag of sugar, but like they were saying, I have to cut down on juice and stuff like that, which I've tried to do, as opposed to picking like a glass of ginger ale or a glass of juice. I'm being more conscious just to drink my water, which I like water anyway. So so it's not going to be taken to the point where I need to go on insulin or anything. Like even my doctor just said this week that at this late in the game, let's not focus too deeply on this because I'm still healthy, my blood pressure's good, I am slightly anemic, which is kind of crappy, and I finally quit taking the nausea medication over about the last week and a half, and I've been able to stay off of it without vomiting, which is good. I do still have my morning nausea and stuff, but I'm able to kind of just push through it and try to ignore it. It's not as severe as it used to be. So I had my 36-week appointment this Thursday, yesterday, and it was just, you know, general doctor's appointment. I was weighed, and my weight has stayed the same since last week, which would be, I'm not going to tell you my weight, but as of right now I am 7 pounds lighter than before I got pregnant, which is good, because if you think about it, once I have a 7 or 8 pound baby and all the other fluid weight and everything, I'll probably end up a good 15 or 20 pounds lighter than before I started, which is a lot better than ending up 20 or 30 pounds heavier, right? Especially when I'm already overweight. Trying to think. Blood pressure was fine, and I did get the strep B test done, the swab, which was nerve-wracking for me. I don't like anything done down there, and I'll be told about the results of that next week. So as of this appointment this week, I'm going weekly now until the end, and all of my appointments are pre-booked, and I'm going to be seeing a different doctor from the practice every week because there's 4 doctors. 2 of them I already know from my last pregnancy, but they want to let me have an appointment with at least one of each of them, just in case the day I have the baby, they're the ones that are delivering babies. And I don't really have a specific doctor in that group that I do or do not want to deliver. I just know I'm happy I'm not with the OBGYN I was a couple months ago. That's all I care about right now. I discussed my fear of pain and losing control and being in agony because of my last birth experience with the epidural that didn't work, the anesthesiologist who was rude, etc., etc. And she kind of made me feel better when she told me that that doctor's actually quit. So, and she actually told me that he was actually notorious for being really rude to obstetrical patients and hating to have anything to do with anybody in pain or making noise. So that's probably why I was treated that way last time. As you'll see from my last video, if it uploaded properly, it's uploading right now, we have finished the baby's room. We've got all of her clothing washed, put away. Everything is just so, everything's ready for her. Yeah, I don't need to get anything for her. Between the baby shower I had on Sunday, which was amazing, my mother threw me a baby shower, and there was a good number of people there, like at least 20 guests or more, and the gifts I got were unbelievable. Baby monitors, baby tubs, diapers, outfits and outfits. She even got her first pair of gold earrings and just anything and everything you would ever need for a baby I got. And after the shower I literally needed nothing for her, which was amazing. I've got some really nice friends and family, that's for sure. Let me think if there's anything I'm forgetting. Oh, the ultrasound report. I had an ultrasound about, well, it would be 2 weeks ago this Friday, so I probably haven't discussed that with you guys yet. It was just an ultrasound to check the weight and position of the baby, because apparently it's a little harder to check position when I've got extra weight on my stomach, right? And the baby is in fact head down, which means no planned C-section, and she was at that time estimated weighing 5 pounds 3 ounces, and that would have been at about 34 weeks. So, and when the doctor talked to me about the ultrasound report at her office yesterday, she said that the baby was measuring 1 day smaller than the due date, which really means nothing. She said she's technically measuring and weighing in at average size. So she's not underweight, she's not overweight, which is good, because obviously there's a worry of a large baby with a diabetic mother, right? My other children were 8 pounds, 7'1", and 8'7". So if I could stick between that 7 and 8 pound range, I'd be happy. Yeah, so all's doing well with the baby. Not sleeping at all anymore. Getting up to use the bathroom like every hour and a half. And when I'm not using the bathroom, I'm just laying awake. My mind's running. I'm not comfortable anymore. I'm short of breath. That whole great bit, you know. And yeah, my job is really stressing me out, and I'm not stopping working until the day before my due date, and even then I only get 2 weeks off because I do not get maternity leave at all. So every day I take off, I don't get paid. I don't get paid, bills don't get paid. So that's kind of a downer, but I'm just going to try and get through it, you know. I've got a good husband that's going to be helpful and everything, and I've got a good mother that's very helpful, and hopefully my children will be helpful, especially my oldest son, who's, well, he's only 7, but you know, he's able to grab things for me or whatever if I need it for the baby or whatever, right? So hopefully that'll work out. So my next video is going to be a video of my hospital bag that I packed and the bag that I packed for the baby to take to the hospital, and then I guess in the next couple of days I'll be doing a week 37 pregnancy update. If I forgot anything, I'll make a video after this. Otherwise, I'll talk to you guys soon.